Hello, everybody. Thank you for joining us today. This is an informal lab, and what we're going to be doing is telling you some of the different capabilities that we have on the AccelaCAPTURE forms. You know, ICD-10 has come and gone, so a lot of you may be wondering what's next and what is the future going to look like. We're going to talk about some different form features today. Some of these are things that you may already be using. Some of them may be new to you. If you have questions, feel free to type those in and we'll answer them as we go along. After the webinar today, I will email out the sample form and the notes that I'm using for this webinar so that you guys can go back and refer to that in the future if you want to show that to some of your doctors or some of your other people that in case they might be interested in what you learned today. So just as a reminder, any of the features that we talk about in the forms lab, those are things that might have to require a forms revision, and so you would need to contact your forms rep in order to have these done. This is not something you simply turn on or turn off a lot of times. If I'm not your forms representative, it's probably Catherine Lowry. If you don't know who your forms representative is, you can send us a question and we'll be able to figure that out for you. As with any forms revision, there will be a fee that applies with that based on the amount of work being done. Also, it's important to keep in mind that some of the features we're talking about may require an upgrade to the latest version of AccelaCAPTURE and AccelaSmart. We have a new version coming out called 5.17. I believe it has just been released this week. So we'll let you know if there is something that is dependent on 5.17 in order for you to use that feature. So, one of the questions that we're getting asked a lot these days is, can I design a form that contains only ICD-10 codes? A lot of people do not want to see their old ICD-9 codes anymore. It's the past. We don't like the past. We like what's new, what's bright, what's shiny. And if we can do that, how do we go about doing it? So the answer is you can design a purely ICD-10 form, but there are a lot of complications with that. Just to give you a little background, with the ICD-10 plan that White Plume invoked, is that with the White Plume AccelaCAPTURE product, we were going to take your ICD-9 form as a base where you could use that and it would give you those pop-ups or those custom scenarios that provided the ICD-10 conversions. If there was a one-to-one match, it'd go ahead and change the code. If there was a one-to-many match, it would give you a pop-up where you would have to select it or select the appropriate code. So with what we have already given you today and what you can already use, you have over 4,000 or almost 4,000 free pre-built custom scenarios that are based on the ICD-9 codes as that kind of underlying platform. If you want to create a purely ICD-10 form, the big disadvantage is that there are going to be no pre-built ICD-10 custom scenarios available for you. You're going to have to build those from the ground up. So, you know, part of the purpose that you get with those custom scenarios or those pop-ups is the conservation of space. If you guys had an ICD-10 analysis run on your form, then you would have seen what all of your ICD-9 codes translate to in the 10 world. The average specialty grew from, you know, by a factor of 4.5. If you had 300 diagnosis codes in your ICD-9 environment, you're going to have at least 1,200 in an ICD-10 environment. So when you start talking about forms that grow that much, you have to worry about what that's going to mean on a forms design level. So if you want to design a pure ICD-10 form, you still are going to need to try and conserve space and keep things in a nice, concise, organized fashion that makes it easy for the doctors to use so they're not having to flip through a bunch of tabs or scroll through a bunch of codes in order to get to the information that they need. So when you talk about trying to design a purely ICD-10 form, you can do it, but there would be a lot of work and a lot of information that you'd have to wade through. So the follow-up question to that may be, so does that mean I'm just stuck with an ICD-9 form? That isn't very appealing because for a lot of people, ICD-9 is the past. It is coming gone. It looks like it's old information to your doctors who are thinking firmly in the ICD-10 world. And you do not have to be stuck with an ICD-9 form from this point forward. What we anticipate is that most forms are going to be some kind of combination of both ICD-9 and ICD-10 codes. With ICD-10 codes, you get the advantage of seeing the relevant code on the form, but you also may still have some of those ICD-9 codes that are left in place so that you take advantage of those custom scenarios and don't have to rebuild them in a different environment, and you can continue to use those familiar and convenient pop-ups in order to move forward. Okay, so with forms design, there are a couple of things you have to keep in mind with designing a hybrid form. And the very first thing is format. Now, if you look on your screen, you'll notice that in the header, there's a historical diagnosis box. This is one of the features that has changed in the ICD-10 environment. Some of you may already have a historical diagnosis box on your form. Some of you may not have one at all. We'll talk about what that is in just a minute. But the box itself, if you've had historical diagnosis box for a few years, you probably have one that's about half the size of what you see on this screen. The historical diagnosis box with an ICD-10 format needs to be widened. That's because the ICD-10 codes are longer, and often the descriptions are longer in the new environment. So on this ticket, we had to rearrange the header a little bit so that the historical diagnosis box could display all of the information that might be relevant. And even though you're seeing ICD-9 codes here, it does have the spacing to allow for an ICD-10 code if it was in a live environment. So that's one thing you may notice, first of all, that you might have to change or adjust on your form if it isn't already that big. If it's fairly small, you're probably going to end up having to scroll or having a lot of that information cut off. Another thing that you have to think about are the diagnosis columns. A lot of the diagnosis codes have column width that defaults to only allow for 5 characters, which is all you needed in an ICD-9 world. But you do need a wider column if you want to see the ICD-10 code when it is selected. And so for that reason, you'll notice here that a lot of these columns have been widened. Now, if you're dealing with a tab that has 3 or 4 columns worth of diagnosis codes, when you widen the code column, it may result in the diagnosis description being cut off a little bit. So for example, V5419, you've got almost the exact same line as V54.11, and you've got a -O and a -U. Well, that doesn't necessarily tell the doctors enough information in which to select it. They can click on the code and hover over it, and that will tell them the full description of the code, but you may decide that that's going to slow the doctors down too much because they don't want to hover, and in that case, you may want to either edit the description or widen the columns a little bit. Those are a couple of the options that may be necessary in some forms. Other areas, when widening the column, may not have any negative impact whatsoever. But that's something you definitely want to review when you have your new form, just so you don't have doctors griping at you the minute you go live with the new revised ticket. Okay, so also with the formatting of the form, we've talked about the diagnosis codes, we've talked about historical diagnosis. One thing you also may need to think about is taking off diagnosis codes that are no longer relevant in the ICD-10 world. For example, if you are no longer doing any kind of workman's comp and none of your insurance carriers still require ICD-9 codes, you don't necessarily need to see those on the form. But the ones in particular that are kind of trouble children are the diagnosis for malunion or non-union and aftercare. The reason why you may want to consider taking those off as ICD-9 codes is that they've been restructured in the ICD-10 world. They're now encapsulated with the diagnosis codes that include fracture care. And so because of that, where in the ICD-9 world you may have gone and marked your fracture code and then marked malunion, you now get to go just straight to your fracture code in ICD-10, mark that, and then select the appropriate episode of care, initial, subsequent, malunion, non-union, delayed healing, and all those types of things. So one of the problems that you get with ICD-9 codes is that the forward mapping, meaning going from the 9 code to the 10 code for malunion, non-union, and aftercare or late effect codes, actually presents you with this huge long list of diagnosis code options that you really don't need. And because of that, it may be better to remove those codes to avoid confusion, knowing that those are going to be covered on the fracture care diagnosis. Okay, so one thing I forgot to mention when we were talking about the historical diagnosis, if you do not already have that on your form, this is something that you may want to consider adding. It is something that is actually fairly useful to many of our clients. The historical diagnosis box presents the most recently billed diagnoses for a particular patient, and it's based on what has been saved on their latest claim that has been billed. So it'll remember the top 10 most recent diagnosis codes for that particular patient. They show in descending order based on date. It has the code, the description, date of service. Duplicates of the exact same diagnosis and description are eliminated. But what's nice about that section is it allows you to select the diagnosis from that list if it's still a continuing condition. That way the doctors do not have to go to individual tabs to select the codes. It will also be convenient just as a reference tool. If the doctors see that, hey, I had somebody in here a month ago for bronchitis, I'm going to follow up and make sure there are no lingering effects from that. So anyway, if this is something that you are not using, that is definitely a good tool to implement on your forms. Now, one thing that has been noticed by some clients is that in the 516 version of the AccelaCAPTURE product, people will go to the historical diagnosis box and try to select the initial code for a diagnosis, and it's not letting them. It'll give them subsequent, it'll give them late effect or whatever. But some people are saying, hey, it's still a continuing condition. I still need to mark this is an initial treatment because it's ongoing, and how can I do that? In 517, we have corrected that problem. So if that is something you are dealing with today, you will want to upgrade to 517 in order to have the ability to mark from the historical diagnosis box, or remark, I should say, the initial diagnosis. If you are still on version 516, you will have to go to the tab, the diagnosis tab, in order to re-select it that way, just as a workaround until you get a chance to upgrade. Okay, so the next step in trying to create a hybrid ICD-9, ICD-10 form is to request an ICD-10 analysis. And what that is we will take a list of all of your ICD-9 codes on your form, we will convert them into ICD-10, and we will evaluate and send you that evaluation so that you can see exactly what your codes are going to convert to. Now that analysis may be something you have already done in the past year, but if you have not done it recently and you've done revisions since then, it might be a good idea to go ahead and do it again. The ICD-10 analysis will tell you which codes have a one-to-one conversion and which ones have a one-to-many conversion. It will also be a good baseline for telling you how many diagnosis codes would be involved if you wanted to take your entire form and make it ICD-10. If you will realize, okay, I used to have 300 codes in ICD-9. Based on my analysis, I'll have 1,200. Well, that means I'm going to have to add at least 4 times more tabs in order to accommodate all those diagnosis codes. Now, that will kind of give you an idea of what amount of work and what amount of revision will be involved if you want a purely ICD-10 form. However, I think the great benefit of the ICD-10 analysis is that it allows you to review which ICD-10 codes are going to be something that you guys use in your practice and which ones may not be very relevant. For example, I had one client who had a generic code, 729.5, pain in limb, that was on each of her diagnosis tabs. Well, her diagnosis tabs were anatomy specific. So she had one for shoulder, one for hip, one for leg, one for foot. And that 729.5 was perfectly fine in the ICD-9 world. But when you got to ICD-10, the custom scenario gave her all the options for the different anatomical sites because that code is more expansive in ICD-10. And so it became confusing for the doctor to be going to a diagnosis shoulder tab and see pain in limb give him the options for pain in limb, shoulder, hip, by whatever. And so that was an area where they needed to go in and revise their custom scenario and revise their form to make their code options relevant to the tab and the forms design. So that's just one example of something to look at. Okay, so one thing also to keep in mind about the ICD-10 analysis, if you have done any work on your end with editing the custom scenarios, then you are going to not see those in our ICD-10 analysis. We are running our analysis off of the official White Plume master files. So it may not have some of the work that you have done, but it will at least get you in the ballpark to deal with those and evaluate those codes if you haven't already done so. Okay, so next thing to talk about is with your forms, if you are a legacy client who has been with us for many years, you may notice that the demographic header at the very top of this form is maybe different from what you guys were seeing. We have tried to start designing the demographic headers to be very specific not only to your PM system and less generic, but we're also designing them in ways that make sense for your workflow and are based on a little bit more customer interaction. With the advent of HIPAA, we've had a lot of clients ask us to remove things like social security number, patient phone number, stuff like that that used to be allowed on our forms. If you have those on your forms today, I actually would probably encourage you to take them off just for extra HIPAA security. But you can also revise that header if you just don't like the flow of how everything goes. Now, when it comes to the header information, where it has patient name, reason for the visit, all that stuff, we've had a lot of clients who've asked us to display new information in the header that may not be part of our default design. When it comes to information in the appointment, we may get more information in the appointment than what we have displayed in the header. Sometimes we can provide that for you, sometimes we cannot. It depends on the practice management system. So for example, if we receive copay, a suggested copay amount in the appointment, then there's a possibility that we can give that to you as a read-only field in the header. This does require a little research. We do have to check out what comes across in the appointment. If it isn't sent to us by your PM system, the chances of us mapping it are pretty much zero. But if there is information you see on the PM side that you think, man, that would really be helpful if we could see that in Capture, you can at least ask us about it, and we'll be happy to figure out if that is something we can provide to you. Other things, the field labels in the demographic header can be changed. So for some people, they prefer to see billing provider on the provider line because that's specific. That's more specific to the language that they use. Instead of referring doctor, they might use resource or something like that. So if there is anything in the header that you think, well, this is generic, it's not really specific to us, and we have to learn a new language and we don't want to do that, we can actually change that. And we can help you out and make that work better for you guys. All right, so now we're going to get into a few more of the forms design options. And bear with me 1 second. I need to see if I can do one thing. Okay. All right, the first thing we're going to talk about is diagnosis column options. We had many clients, when we were doing a lot of our preliminary work, start asking us to give them options for code selection that does not include that custom scenario pop-up. In this situation, we have on this form shoulder or AC joint pain. If you go over here and you click left, then that is going to select M25.512 shoulder pain of the left shoulder. Okay, if you mark right, then it's going to give you the right diagnosis for that. This is similar to how we handle our modifiers on the procedure side. You select a code, or you select the column option, and that automatically gives you the code that you need. These column options are most frequently going to be used when dealing with laterality. left, right, bilateral options on the codes. You can use it in other areas. However, you can notice that it takes up a fair amount of space to design these columns. And so a lot of times what happens is you're going to be limited to at least 3 or 4 options on any given line item, because that's going to take up about half the space of the column width. You're also going to be pretty much restricted to 2 columns. Now we can display these left, right, right, left, whatever you want to do. You may also notice that there is no code column. The forms design here really only gives you the description and the column option. If you hover over your selection, it will give you a tooltip that will show you the code. But on the rank and link screen, it will give you the codes that you have selected, so you can see both the code and the description in case you need to verify that. Part of the reason why the code is not displayed here is that's partially a design restriction, but also in talking to customers, we realized that ICD-10 codes, they're just not very intuitive, unlike ICD-9, which we've been working in for 20+ years. You know, ICD-9 codes are 5 digits, they're easy to memorize, they're limited, they're numeric unless you're dealing with a V code or an E code. Well, you're not going to easily memorize the majority of ICD-10 codes. And because of that, they may be less informative to you than just seeing the description. In fact, ICD-10 codes usually have longer descriptions than you had in the old world. And so we've had some people saying we really want to see more of a description because that's going to give us the information we really need to make a code selection. Okay, guys, bear with me. I need to open one thing real quick that I did not have open in order to show you my next trick. So it'll take me just a second to get there. It's always nice to watch the hourglass dance. Okay. All right. Okay, so on the diagnosis shoulder upper arm tab, as we were talking about a minute ago, we can do the left and right. Now, you can also have an option where it's a combination of both 9 and 10 codes that are designed on the same line item. And this is most often going to be used when dealing with diagnoses that have episode of care. So you may have your default description be for the initial code, RC, tear, or strain, traumatic, initial. If you pick left or right, that's going to give you the initial code. But if you want the subsequent code, that's actually going to give you the ICD-10 pop-up so that you can select the appropriate episode of care if it's subsequent. That both reduces the number of clicks, but also gives everything to you on a line item so that you're only really having to deal with the pop-up when you're dealing with subsequent or sequela conditions. So that can kind of give you the best of both worlds. Now, a third option here is if you look at adhesive capsulitis shoulder, you've got left, right, and bilateral. Well, in this instance, the ICD-10 book actually does not give you a bilateral code. You would have to select left and right individually if you're dealing with a patient who has this problem on both sides of their body. But we do have a way of building custom scenarios that allows you to have one click that attaches to 2 codes. And adhesive capsulitis, or I can't say that word, I really can't, capsulitis. When you click bilateral, well, my apologies, I forgot to build a custom scenario on this particular computer. I had it on my master computer. In theory, though, if you click bilateral, what it will do is pull in the left and the right codes on the link screen just by making a single click. My apologies for not having that working here, but I will have it in the notes for you that I send out after this call. So bilateral codes, you can have one click even when it's not already defined as bilateral by the ICD-10 book. That saves the doctor an extra click, saves you an extra step. All right, so We have some people who look at this design and it really appeals to them. We have some people who say that's less of an option. But regardless, that's one of the new tricks in our bags that you can take advantage of if you would like to do that. Okay, so next thing we are going to look at is another design option on the diagnosis side. You can deal, I've got it named on the DX grouped tab. Here, basically what you've got is this little grid where on the left-hand side of the form it tells you the type of injury, abrasion, contusion, crushing, whatever, and then you have columns with the specific anatomical sites. You have, if you select the code and hover over it, you have a short description and a long description. You have the short description, which is the abbreviation of the anatomical site. But then you have the full description behind that to make sure you've actually selected the right thing once you get to the rank and length tab. But if you click on that, it'll give you the pop-up grid. In some cases, it may give you more anatomical sites because, once again, ICD-10 codes can often become more expansive. Or it may just give you a single option. Well, not that one. It may give you a single option based on the one that you select, but you may still have to choose right and left depending on what's going on. But this was just a different design feature that one of our customers came up with, and we thought that this was nice and nifty and kind of cool and different, and so if you're looking for something different on your forms, that may be an option for you. Okay, the next thing I want to show you is actually on the procedure side. One thing that has become very popular is to create bundled joint injections. Oftentimes, physicians will give the same joint injection and medication dosage all day, every day. Like whenever they go to the shoulder, they always give a single shot of Kenalog, 10 milligrams. Or if they do it for the hip, they may do, that's a way for them to track different injections on the same day, same visit. Now, a lot of you may already have what's in this top section, which is just a plain, what you see is what you get. You click on your code, then you go over and you click on your drug. But this section called bundled injections, when you click on it, we actually have hard-coded the joint injection procedure, the modifier, the Kenalog drug, and that way the doctor has one click and they're done. So rather than having to click the injection and rather than having to click the medication and possibly additional units and then also a modifier, they just have to do that one click and they can move on with their life. So you still need a section on your form that allows you to do kind of on-the-fly, standalone injections. But if you ever have commonly billed combo drugs or treatments, this is a good example of places to do that. All right. And also, still on injections, what I'm finding with a lot of new customers is that many of them, even if they don't do bundled injections, they'll at least have 2 injection sections, so that the first one deals with the first anatomical site, and the second section is duplicated, same exact codes for the second site. That's an easier way for the doctors to mark different treatments in the same visit. Okay. So those are some of our features that we've got on our form, some of the new tricks. So we're going to talk about some of the other questions that we may have. So if you guys have any kind of hard-coded diagnosis codes associated with your procedure codes, you may be wondering, okay, I'm still defaulting to the 9 code. How can I get that to an ICD-10 code? I don't get the pop-up on that because it doesn't show up until that procedure reaches AccelaSmart. For example, you may see that on vaccines where you've got a flu shot that's always attached to V04.81. You may see that on E&M exams where you may have V20.2 associated with certain exams. If you are seeing ICD-9 code based on this hard-coded billing, procedure diagnosis combos, these are actually fairly easy to change. If you have your ICD-10 analysis, then you can find which of those codes actually have a 1-to-1 exact match. If there is a 1-to-1 exact match between the ICD-9 and ICD-10 code, then we can actually go into your form and replace the default 9 code with a 10 code. However, nothing's ever that easy in ICD-10. We have a lot of diagnosis codes that have a 1-to-many match. So in the situations where you have a 1-to-many match, then you have to evaluate, okay, in the options that I'm given, do all of these apply based on the circumstances, or is only one really relevant to the code that I'm looking at? If only one code is relevant, then you can assign that as your default. But if it's more than one, then you're probably going to have to remove that automatic diagnosis programming and select that diagnosis from the tab as you would any other diagnosis. This is going to be seen for any kind of pediatrics group that does well-check visits. A lot of those forms defaulted to V20.2. That code now expands to 2 different diagnoses, one for basically well child with abnormal findings and well child with or sick child without abnormal findings. And so you can't necessarily have the default because not every visit is going to be a well check and not every visit is going to be a sick visit. So that's an example of one where what used to work in ICD-9 may have to be adjusted in the ICD-10 world. Okay, another question that we are getting from a lot of people is whether we can default our procedure modifiers with a diagnosis code that is specific to that side of the body. For example, if you had a wrist fracture and you mark left, then that modifier would automatically pull left wrist fracture in the diagnosis world. That is not something we currently have the ability to do. Part of that is there are just way too many options. There are lots of different types of wrist fractures now. One thing you can do to make things a little bit more convenient, I'm actually going to pull this up in Capture, is if you have your fracture care tab, you can put a column for your diagnosis code next to the side, and that will pop open the different options that are relevant for that particular procedure. So that is one thing that you can do. You could also design a diagnosis section to the right that is similar to what we saw under the ICD-10 tabs, where you could actually have your diagnosis line with the left-right grouped with your procedure codes as well. Either one works. Either one would be possible, and that might make things a little bit more convenient. But for right now, you still have to mark those 2 items separately in order to enter them into our system. Okay. The next thing we're going to look at is some troubleshooting. One of the questions we get is, I am getting a custom scenario pop-up, but there is only one code option. How can I make that pop-up go away? In ICD-9, there are very few exact one-to-one matches in the ICD-10 world. Sometimes the closest they get to is an approximate match, meaning the definition in the 2 books for ICD-9 versus ICD-10 is slightly different. And you're going to get that pop-up because we, White Plume, don't want to make you select the code that isn't exactly the same. We're not going to translate it. We want you to make sure, oh yes, that is in fact what I really do mean. Now, those approximates can get kind of annoying, especially if your doctors say, why bother seeing the pop-up? Why can't it just change? You can handle that in a couple of different ways. If you do your ICD-10 analysis, we will be able to show you how many of those are exact or approximate one-to-one matches. And for those that only give you one code option, we can go ahead and swap the 9 code out for the 10 code on the form. Another thing you can do is you can actually create a custom scenario where you look up that ICD-9 code and you create a single custom scenario, and in that window where you are filling out the details and it says approximate, you would uncheck that, and that would prevent the custom scenario box from the custom scenario box from popping up in the Capture environment. So, in case you need a reminder, the custom scenarios are edited in ePass Support Maintenance. You go under Tools, you go to Custom Scenario Editor, and in the top banner, as you build a rule, you would have like no equivalent, approximation, stack scenarios, and I'm going to show you real quick how you would do this. You can click on the button that says Add. You type in the code that you want to create the custom scenario for. You click Look Up with Pam, select the code, click Custom, and when it gives you the grid, you click in the blank box to reassign the code, and where it says approximation, you uncheck that, and that way, when the next time you see VO4.81 or whatever the code is you happen to be looking at, it will automatically change the code from yellow to green and not give you that pop-up that you may be used to seeing. Okay. One other note, some of you guys may be savvy users and actually may know how to edit some of the codes in your form. If you have edited an ICD-10 code in Super Bill Wizard and you are no longer getting the pop-up you want, or it's giving you an error message saying, hey, I don't recognize this code, that means you either have an invalid ICD-10 code or something is not configured right in custom scenarios to match up to that code. Or you may need an adjustment on your form. Your form is going to default to an ICD-10 base unless we tell it otherwise. So if you try to go in there and easily swap out that code, you might run into a problem with it, but you can give us a call and we can help you figure that out. Okay. Also still dealing with the same topic of approximate diagnosis codes. If you decide, I don't want to have to go through each and every single individual ICD-10 one-to-one match that is approximate, meaning it's not an exact, and create a custom scenario for each one, and I don't want to redesign my form, one thing you can do is you can go to ePass configuration, and under there is actually an option where you can permanently turn off that setting, if I find it. There we go. Okay, so if you open up ePass configuration, under the main item code configuration, at the very bottom of the screen on the right, you're going to have options. You're going to have one that says, do not require selection for one-to-one GEMS approximation. If you check that, then that permanently turns that flash and that warning off that you get in AccelaCAPTURE. If you are a hyper-paranoid coder, kind of like I am, you may still want to go by the one-by-one evaluations in your analysis to make sure you're really okay with making this decision. Okay, also while we're here, the custom scenarios as they are built today default to a certain column order when dealing with laterality. It defaults to showing left as the first site and right as the second. Some people do not code that way. They think right, left, and would prefer to see those options. Now, on this same screen, there's a checkbox that will tell you whether to show right lateralities before the left, but if you uncheck it, then it's going to show left versus right. So those are some options that you can look at if you have a preference on how you see those codes. Okay. Another thing that we have gotten a lot is people will get custom scenarios and they'll mark a code and the window will close, but they want to mark an additional code. And so we have gotten the question of how do I keep my custom scenario box? How do I get it to stay open when I need to select more than one code on that screen? So if you go open up a custom scenario, and I'm in the wrong screen. There we go. What you can do in the top left corner, there is a pen icon. And if you click it, then that will allow you to select more than one diagnosis on the custom scenario. Okay. Another question that we get is, all right, when in the forms world, when we do forms revisions, we will send you a copy of the capture form in draft mode, and you have to have eForm Viewer installed in order to view it. However, this has caused a few problems in the new world because that eForm still only shows you what's designed on the form itself, meaning if you have an ICD-10 code, you're seeing the 9 code, you're not going to get the 10 pop-ups. And a lot of people don't know why that is. The eForm viewer is designed to operate independently of any AccelaCAPTURE or AccelaSmart products being installed. That's for our new customers who are coming in and need to review a form before they've got everything in place. It also allows people to review forms on different computers that may not have the applications installed, say, for example, your home computer, because you couldn't get the review done during the day when you're doing everything else. So with the eForm viewer, it doesn't attach to any database. And all of our ICD-10 translations or custom scenarios are based on having a database in place in order to view it. So your review process may become a little bit more complicated. In the one sense, it's exactly the same as it was before ICD-10. You go to your form, you make sure all the appropriate lines are there that you need. But if you have adjusted the custom scenarios or asked us to adjust them for you, we're going to have to install those custom scenarios, and you're going to have to go to ePass Support Main and look at the code. Excuse me, let me pick a good one. In the editor and click Preview. The Preview button is going to tell you exactly how the code will look when it's in AccelaCAPTURE. So if there has been any kind of custom scenario manipulation that you want to double check, or if you have asked us to do something for you, you'll still have to go to the editor in order to see that and review it. So that's one thing that you'll need to just keep in mind when dealing with forms that may have a combination of IC9, IC10 codes on them, and you're still trying to see the pop-ups. Okay, let's see. Guys, that actually is the end of that presentation. Do we have any questions that need to be shared with the group, or any questions that you would like to ask, or anything you would like to see again?
We actually didn't have any. I'm sorry, we just got a question, so hang on a second. Sorry, guys. How do I choose distal and medial the length of phalanx for a fracture of right index finger using the scenario drop down?
Okay, we have a question about how to select medial or distal phalanx fracture of the right index finger using the drop down. Okay, so I happen to be on a foot and ankle tab, but they work in the same way that fingers do. So for the sake of our example here, I will show it to you. In the original world, I had 825.0, and it gives me my pop-up. Oops, excuse me, I'm on the wrong code. I really wanted 826.0, and that gives me my pop-up scenario. And this is one where about midway down, we have displaced fracture of medial phalanx of the lesser toe, or displaced fracture of the distal phalanx of the lesser toe. So you've got lots of different options, so you have to figure out, first of all, what is the right type that you're looking for. And if you're picking more than one, then you hit that pin in the top left corner of that box, and then you can select the appropriate codes that may apply. Okay? All right, guys, that was the only question that we had that came in. Thank you so much for joining us today. I will email out the notes and the sample form so that you guys can play around with it on your own. And if you have any questions, feel free to follow up with Allison Singer or Catherine Lowry, one of your forums reps. And we appreciate your feedback. If this was helpful to you, we'd definitely like to know it. If there's some constructive criticism, we'd definitely like to hear that too, because we'd like to learn from things. Otherwise, I hope you have a great day and a happy Thanksgiving.